CNN. 10 states saw a record number of new COVID-19 cases this week, and one of them could be the next epicenter of the pandemic.
Florida reported 3,207 additional coronavirus cases on Thursday, the largest single-day count in the state since the pandemic, according to Florida Department of Health. Florida's total reported cases climbed to nearly 86,000, according to data released by the state.
The Sunshine State has all the markings of the next large epicenter of coronavirus transmission, and risks being the worst it has ever been, according to Wednesday's projections from a model by scientists at Children's Hospital of Philadelphia and the University of Pennsylvania.
The potential for the virus to take off there is very, very nerve-wracking and could have catastrophic consequences, because of the state's aging population and the prevalence of nursing homes and retirement communities. Dr. Gene Marazzo, director of the Division of Infectious Diseases at the University of Alabama at Birmingham, told CNN on Thursday.
Florida joins 9 other states, Alabama, Arizona, California, Nevada, North Carolina, Oklahoma, Oregon, South Carolina and Texas, that are seeing record-high 7-day averages of new coronavirus cases per day, according to a CNN analysis of data from Johns Hopkins University.
More than 3/4 of Florida's adult intensive care unit beds are occupied, according to data from the Florida Agency for Health Care Administration. General hospital beds were at nearly 75% capacity across the state.
In Arizona, health officials on Thursday reported a new single-day high for coronavirus cases for the second time in this week, with 2,519 new cases.
What we're looking at is the reality that we're going to have rolling outbreaks, Dr. Scott Gottlieb, former commissioner of the U.S. Food and Drug Administration, said on MSNBC's Morning Joe on Thursday. There's going to be parts of the country that get hot where there's a lot of infection.
Gottlieb said, more complacency in southern and southwestern states not initially hit hard by the virus has led to full-blown outbreaks.
We've never finished the first wave.
23 states are seeing an upward trend in new coronavirus cases, and health experts continue to stress the importance of taking precautions to reduce the virus's spread. Despite the rising number of cases, the White House has downplayed the risks, with President Donald Trump saying Wednesday in an interview with Gray TV that the virus is dying out.
With the White House narrative at odds with the data, health experts including Dr. Deborah Birx and Dr. Anthony Fauci have been absent from many public updates. Dr. Jonathan Reiner, a professor of medicine at George Washington University, told CNN it's because they tell the truth.
And the truth is that the pandemic is still very, very active in the United States and that we're not getting back to normal and there are difficult things that the public has to do, Reiner said.
Diane, a nurse from Houston, Texas, sunbathes at the beach next to her husband, both wearing face masks, in Miami Beach, Florida.
Fauci warned about an anti-science bias contributing to case spikes in the country.
One of the problems we face in the United States is that unfortunately, there is a combination of an anti-science bias that people are, for reasons that sometimes are, inconceivable and not understandable, they just don't believe science and they don't believe authority, Fauci said in an episode of the U.S. Department of Health and Human Services podcast, Learning Curve, on Wednesday.
So when they see someone up in the White House, which has an air of authority to it, who's talking about science, that there are some people who just don't believe that, and that's unfortunate because, science is truth.
States reporting spikes in new cases will have to re-implement significant levels of social distancing to contain the spread, Dr. Peter Hotez, a professor of pediatrics and molecular virology and microbiology at Baylor College of Medicine, told CNN's New Day on Thursday.
We've never finished the first wave, Hotez, dean of the National School of Tropical Medicine, said of spikes in new cases in Florida, Texas and Arizona. We didn't complete that social distancing period that we needed to do.
Models showed states needed to extend stay-at-home orders through May, according to Hotez.
Things opened up prematurely, he said.
How states are trending.
According to data from Johns Hopkins University.
23 states are seeing upward trends in newly reported cases from one week to the next: Alabama, Alaska, Arizona, Arkansas, California, Delaware, Florida, Georgia, Hawaii, Idaho, Kansas, Oregon, Louisiana, Montana, Nevada, North Carolina, Oklahoma, South Carolina, Tennessee, Texas, Washington, West Virginia and Wyoming.
8 states are seeing steady numbers of newly reported cases: Indiana, Maine, Mississippi, Missouri, Nebraska, Ohio, South Dakota and Utah.
18 states are seeing a downward trend: Colorado, Connecticut, Illinois, Iowa, Kentucky, Maryland, Massachusetts, Michigan, Minnesota, New Hampshire, New Mexico, New Jersey, New York, North Dakota, Pennsylvania, Rhode Island, Virginia and Wisconsin.
One state, Vermont, has seen a decrease of at least 50%.
Nationwide, more than 2 million people have been infected and 117,972 people have died of the virus. The virus claimed 755 lives Wednesday in the U.S., according to data from Johns Hopkins University.
Officials downplay record cases.
State officials are navigating the outbreak and managing the rising number of infections on their own.
Los Angeles County, which accounts for almost half of California's cases, reported Wednesday another single-day high of new cases. But officials attributed the county's increase to a lag in test reports.
Other politicians have also attributed higher case numbers to increased testing, but Dr. Ezekiel Emanuel, chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania, said surges are outpacing testing.
When you see 50% or 150% increase in the number of cases you are seeing, which is what we are seeing across the South, that's not testing. That's new cases. That's community spread, he said.
Texas also reported a record high number of daily COVID-19 hospitalizations on Monday, with 2,326.
Florida recorded nearly 2,800 new coronavirus cases on Monday, its highest number of new and confirmed cases in a single day, according to the Florida Department of Health.
But Governor Ron DeSantis said the state will not shut down. The governor attributed the spike in cases to increased testing as well as outbreaks in prisons, agricultural communities and long-term care facilities.
Alabama and Arizona join calls for mask mandates.
Some local officials are hoping to manage the spread by mandating mask usage.
A day after the city council failed to pass an ordinance, Montgomery, Alabama, Mayor Stephen Reed implemented an executive order Wednesday requiring those in the city to wear face masks and coverings in public, according to a post from the city's official Twitter account.
Arizona physicians have called upon Governor Doug Ducey to implement a similar executive order statewide. While the governor announced Wednesday that he would be calling up 300 National Guard soldiers to help with contact tracing, he said he would leave mask requirement decisions to mayors.
Some local leaders are unlikely to follow the mandate, rendering it a self-defeating executive order, he said.
Earlier this week, 9 Texas mayors, including those in Houston, Dallas, Austin and San Antonio, urged Governor Greg Abbott to give them the authority to require masks be worn in public, where physical distancing cannot be practiced. The mayors and physicians have reason to believe the requirements could be effective. A study reported Tuesday found that an estimated 230,000 to 450,000 cases of the virus were prevented in states that required mask use between April 8 and May 15. Wearing masks could be key in slowing the spread of the virus in the U.S., Gottlieb, the former FDA commissioner, said on Morning Joe. Uniform masking would go a long way, he said, citing studies that demonstrated the effectiveness of face coverings. Any mask is helpful, but the more protective the mask, the better. Large events yield positive coronavirus tests. Loosening precautions and restrictions means more people are gathering in larger groups, which has, in some cases, swiftly resulted in positive coronavirus tests. Pinal County, Arizona, Sheriff Mark Lamb announced Wednesday that he tested positive for COVID-19 and is self-quarantining for at least 14 days. He likely encountered an infected person at a campaign event he held Saturday, he said. The county public health department is working to track everyone he came into contact with, he said on Facebook. Earlier this week, a group of 16 friends in Florida said they all became infected with coronavirus after a night out at a recently reopened bar.
Still, Oklahoma, one of the states reporting a record-setting number of new cases, is scheduled later this week to host a campaign rally for Trump.
When questioned, Trump said he is not worried about attendees getting sick, though attendees must agree not to sue the campaign if they contract the coronavirus.
Actually, Oklahoma has had a very low rate relatively speaking. It is a little spike, a small spike for a specific reason, he said. We'll go there, everyone is going to be safe.
Republican Senator James Lankford of Oklahoma acknowledged Wednesday to CNN the rise in rates, but said the rally should not be postponed and, "We are pushing people to be attentive on this."